It's a real pleasure to be here, to be able to speak to you this morning at the start of this conference, and on a topic that's of such great importance to us globally, nationally, and particularly here in Cumbria. But to start with, I wanted to introduce you to my friend Brian, who you can see on the slides. Brian started running at his local park. Brian started running at his local park run at the age of 71. He's now 86. And in that time, he's completed over 700 park runs, volunteered over 500 times. His parkrun achievements have been the subject of national and local media coverage, with the hashtag #BeMoreBrian trending alongside them. But Brian's just one of many examples, I think, of the role that parkrun has had in supporting people of all ages to be active. I know Councillor Bell and I were having a conversation a couple of weeks ago where she talked about a resident she'd been speaking to who was in her 80s, who'd recently got involved in parkrun. And so as something which so well demonstrates, I think, the power of community and activity to bring people of all ages together and keep people well and active for longer, I thought parkrun was a good place to start our day today. And just in case you're all wondering about the rest of the photo, that is me in the background, and that's Sultan, the husky. Sultan's now about 12 or 13, so age has caught up with him a little bit on running, so park walking is now more what he can manage, but nevertheless, he is still relatively active. So I don't think it's news to any of us that we're living in a society which has an ageing population, and that in Cumbria that changing demographic is particularly pronounced. And that was set out in really clear terms in the Chief Medical Officer's report on healthy ageing, which was published just over a year ago. And that included a case study, in fact, on the Live Longer Better programme in Cumbria, contributed by Claire. And this is the front cover from the report, which, as you can see, is a map of England, but and Wales is on there as well, isn't it? But the lighter yellow and green shading shows the areas with the lowest proportion of the population, aged 75 and older. And the darker shades and the sort of blues on there show the areas with the highest. And we can see between the two maps how this is expected to shift between 2021 and 2043. And then with that zoomed in section, we can really see why Cumbria was perhaps one of the areas of focus in that report. We've already got a higher proportion of older adults than many other areas of the country, and that's a trend that's set to continue. And then just briefly, with apologies to colleagues who work in the Cumberland parts of the county, I'm just going to focus on some Westmorland and Furness data briefly, although many of the themes here will be the same right across Cumbria. So this slide shows how our population is likely to change over the 25-year period from 2018 to 2043. And the bars show the percentage increase or decrease for each age group rather than absolute numbers. Although if your eyesight's good enough, then the actual numbers are in brackets too. But what really stands out is that bar on the right, isn't it? Showing a 75% increase in over 85-year-olds in that time period. And there's clearly a really good news story there, isn't there? That people are living longer, although we know that here people moving in absolutely contributes to those change in numbers as well. But alongside this, we're also seeing decreases in the child and working age adult population. And that's where some significant risk potentially emerges for us in us having sufficient workforce to deliver services and potentially to support people in older age. And if we split this down by locality, we can see that the trend in the working age to older adult ratio is particularly pronounced in some parts of our area. So Eden and South Lakeland are those two lines at the top of the graph. And this is something that we're already experiencing in terms of that difference in ratios. But we also need to ensure that we're prepared for where that trend is going, because it's going upwards quite steeply over the coming 25 years. And ensuring that we take action now to address that future trend is particularly important. because sadly the overall health of our population is not improving as it did in the past. Both healthy life expectancy and life expectancy are now falling, and the gap between groups and areas is widening. This means that although people are living longer, they're spending more of their lives in ill health, and the number of years spent in ill health has a really strong deprivation gradient. So the less well off you are, the more years you will spend in poor health. As I've already mentioned, our population projections indicate that the proportion of our population over 65 is set to increase significantly in the coming years. Based on current trends, that's going to be accompanied by significant increases in disease prevalence. So on this slide you can see some nationally calculated figures, and they're based on 2011 census data and contemporary disease prevalence. Therefore, these are really likely to be underestimates of what we're likely to see in the future. But even these figures are quite startling, even with them being underestimates. The proportion of people aged 65 and over living with a limiting long-term illness is forecast to rise by 27%. Dementia is forecast to rise by 38%. You can see some of the other figures on that slide too. If that trend continues, clearly it's going to be problematic for the individuals who experience those conditions, but it will also be really challenging for service provision and wider society. But it's not inevitable. Many of these conditions are preventable, and there are things that we can do to change this pattern and this trend. I might be a slide behind here actually. Let me, oh, they've stopped moving on. What have I done? Oh, there we go. Apologies. So that was the population projections one that I was just talking to. There are the numbers. Right. So on this graph, we're still with population projections, but this graph shows how those forecasted rises in disease will change over the coming 20 or so years. And we can see that to begin with, that rise is quite slow and incremental, and that's already occurring year on year. And this is why prevention is so important, because we really need to prevent that incline from becoming more steep. And we also need to ensure that our services and places are planning for that increase in disease burden, because some of it is already baked in from what we know about people's lifestyles to date and experiences of health and care. Oh, not sure what the slides have got a mind of their own here, I think, but there we go. Hopefully we'll stay on this one now. So back to the Chief Medical Officer report where I started, and some of the key messages, as I think these give a really good summary of the key issues. So what Chris Whitty said in his report is that we must focus on maximising independence and minimising the time in ill health between people reaching older age and the end of life. And that ill health and disability in older age are not inevitable. Again, it's that message that this is preventable. He also said that the proportion of older adults in some parts of the country will be substantial. At the same time, the proportion of working age people able to provide care is often reducing in those same areas. If there was any doubt that Cumbria was one of those areas referred to, I think the quotation that's on the slide there from the report takes away any doubt. I'll give you a moment to read it, but it felt very apt for Cumbria as a description. And then what the CMO report advises that we should be doing is that we need a twofold approach. We need to reduce and delay the onset of disease, but also we need to change the environment so that everyone can maintain their independence for longer. And that's where physical activity can really have a major role. It's probably a cliche to say that physical activity is a wonder drug, but I'm going to say it anyway. And thinking about ageing, I think it absolutely is the case. Being active can prevent disease, it can improve cardiovascular and respiratory health, it can improve strength and mobility, reduce falls and MSK conditions, it can reduce incidence of cancer, improve mental well-being. So ensuring that everyone stays active throughout their life and as they age is really vital if we're going to remain healthy and independent for as long as possible. We can help people to remain active and independent in the way we design homes, for instance, so Homes for Life, which adapts to people's changing needs and delay the point at which they might need additional care. Through transport, which means that people can get to the places that they need to get to, whether that's for social activities or day-to-day necessities like shopping and healthcare, and ideally do so actively, although hopefully if they are choosing to cycle, like the people in that photo, they will have cycle helmets on. Groups and facilities and communities as well can support, can prevent social isolation, improve connectedness in communities, and also provide opportunities to be active. And Park Run, where I started, is a clear example of that. So what we've got is this sort of virtuous cycle where these things enable activity, but also being active enables people to make the most of these opportunities, which will keep them healthy and independent for longer. But it's also really important that we use language that's enabling and challenge the idea that ageing is about deficits rather than strengths, or about doing less or being less able. If we don't get this right, we risk people putting limits on themselves or others, or us putting limits on ourselves too. So we really need to change that narrative and framing on ageing to something that's positive. We need everyone to be ambitious about what becoming older can look like for them. Think back to #BeMoreBrian that I mentioned at the start. And we need to put the building blocks and infrastructure in place in society to make sure that can be a reality. There we go, hopefully that'll stay now. So just very briefly, I thought I'd highlight some of the things that we're doing in Westmorland and Furness to support active ageing. Our community power strategy sets out how we intend to work alongside communities and support and enable community power. And age-friendly communities is one of our areas of work. There's already some brilliant work happening in South Lakes, but also in other areas, and we really want to look at how we can work with communities to support and grow this approach. We had a briefing with councillors earlier this week where we explored the role that elected members can play in creating age-friendly communities. And thank you to Claire and Katie and others who were involved in that session. It was really well received. In our new housing strategy, meeting the needs of an ageing population is one of the priorities. And that includes updating homes to be adaptable and plans for some technical and research-based work on ageing well and how we could, on ageing well to support further development of our housing stock. Our Active Wellbeing Strategy isn't quite published yet, but it's been in development over the last year and will be themed around active people, active partnerships and active places. Importantly, it's not just about leisure centres and sport. It's about enabling everyone to be active, and it'll have a strong focus on inequalities and particularly on groups who may find it more difficult to access opportunities to be active and also face greater health challenges. So older adults is certainly one of those groups, as is people with disabilities. And the strategy also considers deprivation and rurality, so watch this space for that being published in the coming weeks. And finally, Barrow Rising. So this is our collaboration between government, BAE Systems and the council, which will see significant investment coming into the town over the coming decade. Some of the individual funding streams are particularly relevant. So work and health, for instance, we've got a £5 million work and health fund, which is about how do we ensure that people are able to remain active and in work for as long as possible, or at least through to the point at which they want to retire. And that it's good work which supports their health and well-being. So one of the specific early projects that we're funding through that is for Barrow Leisure Centre to provide the BEATS programme and MSK support to people who are on the Work Well programme, and that's designed to help people stay in and return to work who've got a health condition, whether that be a physical or mental health condition. So to finish, the way in which our population is changing clearly presents us with some challenges, but it also does present us with some fantastic opportunities if we can enable more people to live well and independently for longer. And being active is potentially that wonder drug that can help us achieve this. Thank you.